Hi, today is February 2nd, 2022, and you are watching Pakistan's people-led disaster management. Well, the approach needed to fight COVID-19 has not been consistent over the 2 years of the pandemic because the coming of each new major variant means a change in how the pandemic is proceeding and how we need to fight it. The latest variant, Omicron, is completely changing the game, and it has put us into a situation where it's very difficult for us to decide what we need to do. That's because Omicron has a mixed range of qualities. It is far more contagious and transmissible than all the previous forms of COVID-19, including the most transmissible form until now, Delta. But on the other hand, it is far less virulent than all these other variants, which means that when people get infected with Omicron, they are less likely to get sick and die. And infection with Omicron produces effective immunity against the other variants, which means that Omicron is wiping out those more dangerous COVID-19 viruses. So what should we do then? Does that mean that Omicron is finally bringing the pandemic to an end and that we should embrace it? Well, not so fast, because Omicron's very high rate of spread is causing a massive surge in the pandemic all around the world. And that is enough to create an extreme healthcare crisis. In the United States, for example, we're seeing hospitalizations and deaths reach record-breaking paces. That's because an increase in the rate at which a virus spreads causes a major increase in the number of people who get infected within a given period of time, and hence an increase in the proportion of people, in the number of people who die and fall seriously ill. For example, you increase the deadliness of a virus by twice, then that means twice as many people die within a given period of time, but increase the infectiousness by twice, then a far greater number of people die. That's how the R0, the basic reproduction rate of the virus, works. If a virus has R0 of 2, then the infection number goes from 2 to 4 to 8, but if the R0 is 3, then the infections go from 3 to 9 to 27, and as you can see, that's a huge increase after just 3 rounds of infection, and that means more people will die if the proportion of deaths, if the case fatality rate is the same. So that is what we're going to be seeing with Omicron. Ordinary people aren't getting intubated, ending up on ventilators with Omicron as much, but Omicron is claiming a lot of the people who are vulnerable, the elderly and the immunocompromised. Previously, those people were isolating themselves so they would be shielded from COVID-19, but now Omicron is getting to them much more. So they're falling victim. They're among the primary victims of the pandemic now. So what should we do? Well, I think that we need a blended approach. So many people are protesting against lockdowns and social distancing and other public health restrictions across the world, including in Western countries, and governments are clamping down on them, pushing back against the demands. But I don't think we need that attitude anymore. We need to give some leeway to people's desire to reopen society, because Omicron infections are not so dangerous for each person anymore. I think that we should do our best to isolate the vulnerable people, the elderly and immunocompromised, for example. We need to put them under a very strict isolation regime, which does not have to last long, because my prediction is that with Omicron's fast rate of spread, the pandemic will soon come to an end. And all the people who are healthy, who are least vulnerable, we should allow them to go about their business and keep society running. So, and as they catch the virus, that will contribute to herd immunity. But at the same time, we should not allow people to get infected with Omicron too fast, as that could overburden healthcare systems. We just need to make sure that the number of illnesses is at an acceptable level for hospitals to cope with. And so that means we don't need to suppress Omicron spread as much as we need to suppress the spread of the previous forms of COVID-19. And of course, we have to vaccinate people as fast as possible, because vaccination is the only safe way to gain immunity. Omicron infections are not safe for anybody. So let's ramp up our vaccination drive, and let's combine that with making sure that Omicron infects, if Omicron does infect anybody, it's the right sort of people. So in that way we can achieve herd immunity for the world as much as possible, as fast as possible, and that way finally bring the pandemic to an end. That we are treading a fine line here, and we have to make sure that we make the right choices. There are so many opportunities, but also so many risks. So let's continue to study the virus as much as we can and formulate our strategies in the right manner. And this is such a complex and difficult topic that PPLDM is doing all it can to work on it. I published an article on Omicron. The link is in the description below, and on this channel we'll be producing many more videos about Omicron. So please subscribe so you can stay up to date on all these videos. Thank you.